can we do to help you get back in balance? Regenerative injections, people think of as we're going to make cartilage. So we're going to take platelet-rich plasma, which pulls in stem cells and stimulates stem cells, or the actual stem cells themselves, and put them into the joint or the ligaments or the tendons so that they will grow. But really, what I want is healing in my patients. I want their wear and tear and repair to get back in balance. So when you put in a regenerative injection, the tendency is for this to get back in balance because it helps the repair process. As cortisone takes the repair process down, regenerative injections help that repair process get back in balance. Maybe you don't get a big new layer of cartilage, but as we discussed, if you don't have pain that's debilitating, you're fine. You don't have to have a lot of cartilage. I've seen people who have very, very little cartilage or no cartilage and are functioning fine. I've seen people with no cartilage on this knee, horrible, horrible pain. No cartilage on this knee, no pain. Usually that's a mechanical factor. So what's happening is this leg is not taking nearly the wear and tear and pressure that this leg is mechanically. So even though they look the same on x-ray, it just goes to show that x-rays and imaging don't show pain. And probably mechanically they're shifting over, weighting the one that's having a lot more pain. That would be one thing that could be happening. Pain can be coming from nerve irritation. Obviously nerves are irritated when you have pain, but you're trying to have a nerve reading damage. The nerve's whole function is to read damage in the tissue and to tell you that you need to go to the hospital because your appendix is bursting, or you need to rest because you did too much and your pain level went up, or you need to get off your foot because it's broken. So the pain itself is a great messenger, but when the nervous system becomes inflamed or irritated or centralized, then the pain itself becomes a problem that can disable you just because it's painful. And that's a big problem. And then you have to do something to change pain. So there's medications, gabapentin is one, Lyrica is another, that people take presumably to shift the centralization and nervous irritation. It's given a lot of times to people who have neuropathy. Shingles is a nerve irritation that's come from an infection. So you're trying to change that nerve irritation. There are other ways to do that. And amazingly, there's a treatment using injection therapy with just D5W, sugar water, that calms nerves down very rapidly. So you can take someone who has an 8 to 10 pain in one area of their body and inject with sugar water along the superficial nerves that feed that area and have within 5 minutes 80 to 90% or more pain relief. But the technique, unfortunately, is not magic. It doesn't completely shift things forever. So you have to repeat it to make it last longer because the effect on the nerves grows as you repeat it. If you repeat it relatively soon when the pain starts to return. If you wait a long time, then you're starting over. So this type of nerve blocking requires that you repeat it in order to get a progressive, more lengthy reduction in irritation of the nerves. So you may start out getting 2 days of pain relief. Re-injected a week later, a week of pain relief. Re-injected maybe 10 days later, 2 weeks of pain relief. Re-injected 2.5 weeks later, maybe 3, 4 weeks. Once you get up to about a month, oftentimes you'll get much more prolonged relief with each one. So it might go from 1 month to 3 months. It's a very, very effective treatment, but it doesn't work all the time, but you almost always know if it's going to work because you get immediate relief. So it's a very nice type of treatment because it gives you relief immediately, but it's not taking away your messenger. It's not taking away the fact that your nerve is still going to read damage into your leg. It's not a local anesthetic. It's not blocking the action of the nerve. It's calming the action of the nerve. It's taking out irritation in the nerve. So you still have your messenger, but you don't have this overstimulated nerve that's blaring out with speaker system that's way too loud and you need to have earplugs. You're at the concert, it's horrible. I remember going to a Who concert and dying in ear pain. I needed earplugs. I needed some sort of treatment for my nerves in my ear. Oh my gosh, that was horrible. I was in like the 5th row. Very bad.
You should wear earplugs.
You should wear earplugs. You should probably just sit in the back. It's a better idea.
That's
Not
funny.
as much fun. It was horrible. You know?
Yeah.
I got out of there and my ears are still ringing, okay? And this is, what, 50 years later, almost?
You still have tinnitus?
Yeah, I still have tinnitus in my ears.
From the, oh wow.
Now, who knows what that was the only thing, of course. It's not like I only went to one concert, but
You really noticed it after that.
I really noticed it, and then you have this chronic thing going on. So that brings up another thing about pain. So I have this tinnitus in my head all the time. It's a high-pitched, just like that. So if it's quiet, it's actually quite loud, and I have learned to just let it go, not pay much attention to it. So that's one thing you can do with a messenger. Presumably this ringing is telling me there's damage in my ears, I would think. So I'm trying not to expose myself to loud noises. But with pain, a lot of people ignore it. And when they ignore it, it's generally going to get worse because it's trying to tell you something. And if it's a pain that's inflamed, then it's very confusing because if you try and do what you think it wants you to do, which is to back off your activity, it may not go away. It's still there. Well, then you might as well ignore it and do your activity. But that doesn't work either. That doesn't solve the problem in the long run. There's got to be something to intervene, to slow down, to calm down the nervous system so that you can have pain, a messenger, a friend, rather than an evil, suffering dragon that just sits there all the time, depressing, horrible, no light at the end of the tunnel. That's what people come in, and unfortunately they often come in way down the line. They've been ignoring it for 1 year, 5 years, 25 years, not paying attention to their pain. And there's a lot of factors that can change. So you have inflammatory factors that can come from your immune system, that can come from over-irritation of the nervous system, that can come from nutritional factors. The biggest poison that you can eat is sugar. As far as inflammation, it loves to create body inflammation. Creates all kinds of problems. So you've got that. Then you have mechanical factors. So what is the mechanics of your knee? Well, if your knee is like this all the time, it's going to wear and tear much more than it needs to. So you're probably going to need to do something to mechanically correct that if you want to get to a pain level that allows you to function.
Yeah. You somehow close that out. So, I mean, let's talk about, you know, how you guys can help with all that. Those are the
Okay.
things. Yeah.
All right. So when you come down to the Center for Regenerative Orthopedics, the first thing you're going to do is see one of my nurses, my assistant probably, who's going to take a history and take a lot of information, and then oftentimes I'm reading and looking at x-rays about you while he's doing that, and then we come in together and I do the physical. And usually it takes 15 minutes, half an hour or more to do the physical in a way that gives me enough information to understand the mechanics and the factors that are causing your problem. And it's very important that you understand that the history, what has happened in the past and how you got there, and the physical, the mechanics, the swelling, the tenderness, give the story probably 95%. Ultrasound or imaging, MRI scan, x-rays can be very helpful, but they do not show pain. So we use them to identify what is in a painful area anatomically if we're going to do something to it, if we're going to change the treatment program. So why get a $1,000 MRI scan if you're not going to do something different after you get the MRI scan? Or why get an x-ray when you know that everybody over 40 has some degenerative disease in their spine, quote unquote, which is really normal. Everybody degenerates as they go through time. So if you go to your doctor and you have low back pain, and you've had it for a long time, maybe a month, and you don't know exactly what caused it, they take an x-ray and it shows degenerative disc disease at L4, 5, and 5-1. There could even be a bulge, which, by the way, you can't see on an x-ray, but people tell you there's bulges all the time. So there it is. Now, that x-ray was just the same when you weren't having pain. So what does that tell you? What's the cause of the pain? Is it what's on the x-ray? I don't think so. That doesn't tell you. It could be involved, but it's not the cause of the pain per se. There's no way to point an image at an anatomy and say this was causing your pain. What you can do is correlate. However, I have a technique that will tell pain generators. So if you have pain and your tender right there, and your pain is coming from right there, and I inject that tendon attachment right there with some local anesthetic, and your pain goes away, we have diagnosed the pain generator. As compared to if we took an image, we might find out that there's all kinds of things going on in the cartilage inside your knee. And you've got all kinds of wear and tear, degeneration in the cartilage in your knee. But your pain's right there. And I injected that, all the pain went away. So obviously what's going on inside your knee is not the problem. So it's important to understand how to diagnose pain generators, but it's also important to understand the underlying stimulation of a pain generator. It's not that just because you turn off a pain generator, you fix the problem. There's got to be something that's causing that pain generator to be active, usually mechanical in most people who have osteoarthritis, which is what I call wear and tear out of balance with repair, osteoarthritis. It hurts when you're out of balance. And when it hurts, you need to know why and what is causing it. And we can do that by diagnostically injecting. We can do that by physically putting our hands on you and palpating the structures and looking at how your feet move and the whole neuromuscular kinetic chain. If you have back pain or knee pain or hip pain or ankle pain, there's a kinetic chain that goes all the way up and down. So just because the pain is in your hip doesn't mean the problem underlying is in your hip. It could be in your pelvis, or it could be your ankle. If you have knee pain, it could be that your foot is flat and overpronating and putting extra stress across the medial part of your knee, so that is getting irritated enough to cause pain. Call us today